Okay, so we're going to get started. I want us to really think about three key questions as we go into this next panel. Um, Back to Kevin's original question, how do we spread and scale the types of investments that are going on now, with different health systems so that it's not just a random act of kindness, but something that's routinized, that's hardwired. So that's one question. I think the second question, and Kevin touched on this a little bit, but I know actually Jeff Levy touched on it when I walked in. What tools do we already have in the toolbox in this area? And number three, who else needs to be at the table? Some perspective on these questions. Nemours is a children's health system. We're an operating foundation. And so we're blessed with a trust fund from our benefactor, Alfred I. DuPont. 10 years ago, we took on this issue of population health because it really was spot on in terms of our mission. And we're all about the kids and impact. And so we expanded beyond the children we see in our hospitals to the whole population in the state of Delaware, for example. So, in doing so, we were defining the community as the state of Delaware and all children in the state of Delaware. And it really changed the way we thought about our work, and it was a mindset change, and it matched our mission. And I'm making that point because I think we need to understand, to Kevin's points earlier about the tremendous opportunity with hospitals, we need to understand what's going to motivate the hospital to do this. What's the business case for doing this? Yes, there's a mission case, and we're going to hear from some health systems later. But what's the business case? And it could be argued that because of all the changes that are happening in the marketplace, including because of the ACA, the Affordable Care Act, it's really critical to the survival of health systems to focus on population health. So building that business case to share with the board and the leaders of a hospital is really going to be important. So we need to really understand what's going to motivate the hospitals to do this. And then I guess the other points I wanted to make is we need to spend time harnessing what's already out there, because Kevin gave some examples. Nemours has been doing this work. There's other children's hospitals that have been doing this type of work as well, nationwide, the hospital in Wisconsin, Cincinnati Children's. And so there are all these examples. And to the point that Kevin made his last couple slides, we need to disseminate these case examples and get the information out. And we need to really think about harnessing innovation. What are the tools that need to be further developed, like developing this template for the business case of doing population health, for a health system doing population health. That's one of these tools that we could develop. And to that point, I did want to announce to folks that Nemours and the UCLA Center for Children and Families and Communities just received a grant from the Kresge Foundation to focus on harnessing innovation and spreading it in this area of population health and clinical care, to really move the field forward and help to develop an open source platform of the tools and cases to move folks forward. So we're really excited about that. And the final thing I want to say before I get to our panelists is, who else should be at the table? Kevin made a great case about hospital health systems, but payers need to be at the table as well. They need to value the outcomes that will be produced in the long term, and the system needs to be incentivized so that these population initiatives can flourish. But there are other people that need to be at the table. So with that, speaking of the table, we have a great panelist with a set of panelists, and their bios are in the books. And first, we're going to hear from Gary Gunderson and Teresa Cutts. They're going to spend combined about 20 minutes on their presentation. Gary Gunderson is Vice President of Faith and Health Ministries at Wake Forest Baptist Medical Center. And Dr. Cutts is Associate Professor in the Department of Social Sciences and Health Policy at Wake Forest School of Medicine. And then we're going to hear from Valerie Agostino, did I say it right, I hope? Okay, who is Senior Vice President of Health and Housing Operations with Mercy Housing. And we're going to take questions at the end. And so I want to hold questions at the end of the presentation, and then we'll have a lively dialogue. We've asked Kevin to come back and be a part of that. With that, let me ask Gary and Teresa to come to the podium.